Brigadier Professor Dr. P.K. Sahoo, Chief Consultant, Neuro Spine Radiosurgery. 80% of the population will develop cervical spondylosis and neck pain beyond the age of 40 years. This is a disease. It is not common in childhood, but these days with lifestyle modification, you may find cervical spondylosis in young people between 20 to 40 years of age. The most common cause for cervical spondylosis is advancing age. But these days, because of lifestyle, because of working with computers, long hours of sitting, avoiding exercises, taking all junk foods, that causes a lot of strain on the neck and it prevents the neck movement, which we call as cervical spondylosis. It is the initial stage of the disease of degeneration of the cervical discs. As you all know, the cervical area has got 7 vertebrae, C1 to C7, with 6 discs in between. The disc that gets degenerated, the bone also becomes osteoporotic or it becomes osteophytic. The ligaments becomes very taut and becomes ossified. All these things give rise to pressure on the nerves passing through them and causes neck pain. Besides that, it may cause also arm pain, weakness on the hands and legs, and also it may cause autonomic imbalance and sphincteric disturbance in the form of, in the long run, if you don't take treatment, it causes problem in urination as well as it causes constipation. It affects the motor system, it affects the sensory system, and also it affects the autonomic nervous system. And if there is a cervical spondylosis, the treatment again 90% will get cured with simple measures of taking rest, certain medications, little physiotherapy, local application of some analgesic gels or ointments. It does not settle down in a period of 3 to 4 weeks. Then we have to think that there is something else other than cervical spondylosis. In that situation, we have to do X-ray cervical spine, MRI of the cervical to find out where is the exact problem, whether it is in the bone, the ligament or the disc, whether it is compressing the nerves, whether compressing the spinal cord. When it compresses the nerve, we call it radiculopathy. To compress the spinal cord, we call it myelopathy. The features of radiculopathy will be neck pain with arm pain. The features of myelopathy will be neck pain, arm pain with weaknesses of the upper limbs, lower limbs, and problems in bowel and bladder. How to diagnose them? By cervical MRI and screening of MRI. And as per the MRI, we have to treat such patients if there is any pathology which causes the myelopathy or radiculopathy. If it requires surgery, surgery can be done in such cases. But we normally manage for a period of 6 to 8 weeks conservative treatment with medications, with physiotherapy, and almost 80% people to improve unless there is some paralysis which is existing before the onset of these problems. And one has to know that if something is not getting improved by 8 weeks of conservative treatment, if there is weaknesses, if there is sensory loss, if there is paralysis, they must come to the neurosurgeon and get the investigation done and treatment as per the advice of the neurosurgeon.